In this video, we are going to discuss about obturator nerve. We discuss first about the formation of obturator nerve. So, obturator nerve is a branch of lumbar plexus and how it is formed. So, what you see here is the ventral rami of L2, L3 and L4 spinal nerves. So, these three are the ventral rami of L2, L3 and L4 spinal nerves. Now this ventral rami of L2 has got a ventral division and the ventral rami of L3 has got a ventral division and the ventral rami of L4 has got a ventral division. So this is one ventral division, ventral division, ventral division. Now the ventral divisions of all this combine together to form which nerve? This nerve is the obturator nerve. So the obturator nerve is formed by the combination of, that is formed by the union of ventral divisions of ventral rami of L2, L3 and L4 spinal nerves. So what about the formation? It is a branch of lumbar plexus which is formed by the union of ventral divisions of ventral rami of L2, L3, L4 spinal nerve. So what is the root value of obturator nerve? The root value is L2, L3, L4. It is formed by the union of ventral divisions. It is a branch of lumbar plexus. So this nerve is supplying the muscles of adductor compartment. Now what about the course of this nerve? I will draw the diagram first. This is a iliac crest. Now this is theta L1, L2, L3, L4, L5. So you have a muscle here. Which is this muscle? This is the psoas major muscle. Now this obturator nerve which is arising, there is a branch of lumbar plexus. Root value is L2, L3 and L4. Now this branch emerges near the medial border of psoas major muscle and it passes downwards. Now it enters the pelvis. It enters the true pelvis in front of the sacroiliac joint and behind the common iliac vessels. Now after entering the pelvis, it travels in the lateral wall of the pelvis, and in the lateral wall of the pelvis it is accompanied by the obturator vessels also. Now in females it is related to the lateral surface of ovary or ovarian fossa, that is the lateral wall of ovarian fossa, lateral surface of ovary. Now it passes downwards, and now what happens, it enters the obturator canal. it enters the obturator canal. In the obturator canal, it divides into anterior and posterior divisions. It divides into anterior and posterior divisions. Now what happens? So what about the course? Course is, first it passes, emerges near the medial border of psoas major. Now what happens? It enters the true pelvis, in front of sacroiliac joint, and behind common iliac vessels. Common iliac artery. Now what happens in the pelvis? In pelvis, it travels along the lateral wall of pelvis along with obturator vessels. This is first, second, third. Obturator vessels. Now what is the important relation in the pelvis? In the pelvis, it is related to the upper border of obturator internus muscle. It travels along the upper border of obturator internus muscle in the lateral wall of pelvis. Internus muscle. Now in females, it is related to lateral wall of ovary. Lateral surface of ovary. Now what happens? It passes through, that is the fourth part, it passes through obturator canal. This neurovascular bundle, that is the obturator nerve along with the obturator vessels, passes through the obturator canal. Then it enters the thigh. Fifth one enters thigh by leaving. Now in the obturator canal itself, it divides into anterior and posterior divisions also. Now the anterior and posterior divisions enters the thigh by leaving. The terminal branches enters the thigh by leaving obturator foramen. That is the terminal branches. Now in the obturator canal, it divides into anterior and posterior division. So which are the muscles here? This is the anterior division. This is the posterior division. You can see a muscle here. This is the obturator externus muscle. Obturator externus muscle. Now the anterior division of the obturator nerve is passing in front of the obturator externus, and the posterior division is passing through the obturator externus muscle. The posterior division passes through the obturator externus, and the posterior division is supplying the obturator externus also. Now what happens to the posterior division? Now we will see the muscles here. We have seen the muscles in the adductor compartment of the thigh. So which are the muscles which form the superficial strata? So the superficial strata is formed by the pectineus muscle, adductor longus muscle, and the gracilis muscle. So this is the pectineus muscle, and you have the adductor longus muscle, and you have another muscle which is this is the gracilis muscle. So this is pectineus, this is adductor longus, this is gracilis muscle. Now posterior to this adductor longus and the pectineus, you have muscle which is in the intermediate stratum. Which is that muscle? That is the adductor brevis. So adductor brevis muscle is located like this. Now what happens to the anterior division of the obturator nerve? The anterior division of the obturator nerve is passing in front of the obturator externus muscle. Now it gives a branch to the articular branch to the hip joint. So anterior division of obturator nerve is supplying the hip joint through an articular branch. Now what happens to the anterior division? The anterior division is passing in between the adductor longus and adductor brevis. So what you see here is the adductor brevis. Adductor brevis. So remember that the anterior division of obturator nerve passes in front of the adductor brevis. In front of the adductor brevis, and it supplies which all muscle? The posterior fibers of pectineus. It is a hybrid muscle. The anterior fibers are supplied by the femoral nerve, but the posterior fibers are supplied by the anterior division of obturator nerve. So anterior division passes in front of adductor brevis and it supplies the pectineus. Now it passes like this and it supplies the adductor longus. Now it passes like this and it is supplying the gracilis also. Now distal to the adductor longus muscle, it is entering the subsartorial canal. Now after entering the subsartorial canal, it gives vascular branches to the femoral artery. So this is vascular branches to the femoral artery, and it is also contributing to the formation of subsartorial plexus of nerves. To subsartorial plexus. So we know that subsartorial plexus is present in the roof of this adductor canal, posterior to the sartorius muscle and in front of the fibrous roof. So it contributes to the formation of subsartorial plexus. Now what happens to the posterior division? So the anterior division is supplying which all muscle? It is supplying the pectineus muscle, that is a part of pectineus, posterior fibers of pectineus muscle. It is supplying the adductor longus muscle. It is supplying the gracilis muscle. Besides that, it gives an articular branch to the hip joint, and after entering the subsartorial canal, it gives vascular branch to femoral artery, and it contributes to subsartorial plexus of nerves also. Now what happens to the now it also supplies another muscle, that is the adductor brevis muscle. So anterior division is also supplying the adductor brevis. So what happens to posterior division? Now the posterior division passes through the obturator externus and supplies this muscle, that is it supplies the obturator externus. Now the posterior division of the nerve passes behind the adductor brevis muscle. Now which muscle is present posterior? That is behind the adductor brevis, that is the deepest muscle, that is the adductor magnus muscle. Now the adductor magnus muscle is present here. So the adductor magnus muscle is also a hybrid muscle. So this is the adductor magnus. Now this muscle has got an adductor part and a hamstring part. The hamstring part is supplied by the tibial part of the sciatic nerve, whereas the adductor part is supplied by the posterior division. Now this is supplying the adductor part of adductor magnus muscle. Now, in case the adductor brevis is not supplied by the anterior division, the posterior division may give a branch to the adductor brevis muscle. So, adductor brevis may be supplied either by anterior division or posterior division. Mostly it is the anterior division which is supplying the adductor brevis. In case the anterior division doesn't supply the muscle, the posterior division may supply this muscle. Now, after giving branch to the adductor magnus and distal to the adductor longus muscle, it enters the popliteal fossa. Now in the popliteal fossa, what happens? Now in the popliteal fossa, it gives a genicular branch So now this genicular branch is supplying the capsule of knee joint and interior of knee joint, internal part of knee joint. So the anterior division is giving articular branch to hip joint. The posterior division also supplies a capsule and inside part of knee joint. So which are the muscles supplied by the anterior and posterior division? We have seen that in the superficial strata you have the pectineus muscle, and you have the adductor longus muscle, and you have the gracilis muscle. And in the intermediate strata you have here the obturator externus muscle, and there is the adductor brevis muscle, and you have a deep muscle which is this is the adductor magnus muscle. Now we have seen that the anterior division passes in front of the obturator externus and it is passing in front of the adductor brevis. It is supplying the pectineus, it is supplying the adductor brevis, it is supplying which muscle here? Adductor longus, and it is supplying the gracilis, and distal to the adductor longus it enters subsartorial canal giving vascular branches and branches to the subsartorial plexus. So this is the anterior division. So anterior division is supplying which all muscles? So what you see here, this is the pectineus muscle. Which part? That is the posterior fibers of pectineus is supplied by the anterior division of obturator nerve, whereas the anterior fibers are supplied by the femoral nerve. So it is a hybrid muscle or a composite muscle. Now which is other muscle supplied by the anterior division, this is the adductor longus. Now the third muscle is the gracilis muscle. And the fourth one you see here is the adductor brevis. Now which is posterior division, we know that the posterior division is passing through the obturator externus. It is supplying this muscle and it passes behind the adductor brevis, and in case this muscle is not supplied by the anterior division, it may supply this muscle also. Now it is supplying the adductor part of adductor magnus muscle, and distal to the adductor longus it enters the popliteal fossa and gives a genicular branch, and after penetrating the oblique popliteal ligament it enters the knee joint. Now which are the muscles supplied by the posterior division? So this is the posterior division. So muscles supplied by the posterior division are: one is the obturator externus muscle. Now, other is the adductor brevis in case it is not supplied by the anterior division. Adductor brevis. Now, the adductor part of adductor magnus muscle. This is adductor part of adductor magnus muscle. These are the muscles supplied, and we have, after entering the subsartorial canal, it gives branches to the femoral artery and branches to the subsartorial plexus. So subsartorial plexus branches are given by the anterior division only. Plexus. Now, the posterior division, it enters the popliteal fossa and it gives a genicular branch. It supplies the capsule of knee joint and it penetrates oblique popliteal ligament and it supplies the inside part of knee joint. Now the anterior division gives a articular branch to hip joint also. So that's all about the obturator now. Thank you for watching this video. To see more videos of my channel, please subscribe the channel. Thank you.